There is an update on the transition of non-emergency medical transportation provision in Wisconsin. We're going to share that update, but we're going to remind you what we're talking about when we say NEMT. Now, this is non-emergency medical transportation. It's getting a ride to a doctor's appointment. This has been a covered service, a benefit of Medicaid since the beginning, since the 1960s. It's a federal requirement that the states make this available to individuals enrolled in Medicaid. And it's based on the idea that Medicaid entitlement to get the care doesn't mean anything if you can't get there. If you can't get from home to doctor's appointment, then having that covered doctor's appointment is not going to make you healthier. So the ride to the appointment has been a long-held tradition in every state to make sure people can get to the health care and coverage they need and deserve. Now, it also has been the subject of a lot of study. There's a lot of research out there that talks about the importance of transportation to getting to health care. Transportation is one of the biggest barriers, and we see that, of course, in our northernmost part of Wisconsin. Trying to get 50 or 60 miles to a specialty clinic or to a hospital can be a burden. So transportation has been identified as a burden. Many people lose their health coverage and their access to care, and they miss appointments because they simply just don't have the ride. This impacts the lowest income and those that are chronically ill most of all. We know from research data as well that in 2015, Medicaid non-emergency medical transportation was most commonly used by people that were trying to access behavioral and mental health services. So we can even drill into the data and find what type of Medicaid enrollee is using this car service or these rides to get to their treatment. And you can get a lot of information about what this looks like. Now, in Wisconsin, this is provided by contract. Wisconsin has used different vendors as the coordinator of rides for any of their Medicaid enrollees. It was a company named Logisticare up until 2013. That switched to a company called MTM. And then there was a new contract that was put out to bid that was supposed to be effective in early 2019. And it was announced that Logisticare once again won that bid. Well, that is now under appeal, and that appeal is ongoing. So there have been a lot of rumors about, hey, the contract is switching again, and the last we heard was it was supposed to be effective for spring of 2019, and that's where the rumors stopped. Well, here's an update to where that contract stands. Yes, that contract is still, and those bids is still under appeal, and that appeal is considered to be ongoing without a resolution in the near future. So for right now, MTM, the current provider, will continue to offer those rides. You call them like you did before. You schedule your ride to your appointment. The processes, everything stays the same as if there was no contract bid at all. So MTM will continue to be the provider for non-emergency medical transportation into the foreseeable future. Now, the Department of Health Services has said that regardless, a transition time would take time no matter what. Say Logisticare does move forward in getting the new contract, they would need at least 6 months of onboarding to get that up and running. So even into the foreseeable future, through the summer, we will not be seeing any changes. Keep calling the numbers you've been calling, keep using the services you've been using. Consider there to be no change right now. That is the current update. Of course, we will make sure that you get updates as we learn them as well. Now, this fits into a bigger conversation, and we have a separate video on this, but here's the snapshot version of this. The Trump administration is projecting that they want to get rid of non-emergency medical transportation moving forward because it's a budget, it's an expense. It's something that they have required the states to do since the 60s. The new budget is projected to suggest that maybe states can make this optional. The feds have already started granting waivers to states that don't want to do this. So states like Iowa, Indiana, and Kentucky already have a waiver from the federal government saying they do not have to provide these services. That would be devastating if this became the norm. We're going to keep our eye on that as well. You can read up on this. We give you a lot of links. We give you the links to some of that language we just talked about. We will also share some of the announcements that we've heard that say no changes, keep using MTM, and we're going to put that link to how to contact MTM in Wisconsin as well in the description below. If you have questions, you can certainly give us a call or send us an email, and you can keep in contact with us at healthwatchwisconsin.org.